It's Plush Tonight, showcasing the latest in professional spa treatments from Plush Medical Spa, Westgate Parkway, Dothan. With owner and medical director, Dr. Amanda Bell, board certified in internal medicine. Here's Dr. Bell with your host, Barbara Kennedy.
Hello, I'm Babs Kennedy. Welcome back to Plush Tonight. We're here at 548 Westgate Parkway at Plush Medical Spa. Dr. Bell, what are we going to be talking about tonight?
We're going to dedicate this episode to skincare. So we're going to discuss all of the Obagi skincare lines. We're going to give you all the information you need about chemical peels and microdermabrasion, and we're going to introduce you to our estheticians who will have even more information for you.
Tonight we're going to be featuring Rachel and Katie, our estheticians. Dr. Bell, tell us again what all that you do here, because you are the doctor here.
Right, and as you've seen in our previous episodes, I do all the Botox and Dysport. I do the dermal filler injections like Restylane and Juvederm and Radiesse. And you've also seen the Thermage CPT skin tightening, which I also do. But the real stars of the show, in my opinion, are Katie and Rachel, because they're here every day taking care of the bread and butter spa detail, and they keep the place running when I'm not here.
Plush Medical Spa on Westgate in Dothan is excited to announce that we offer Thermage CPT skin tightening treatments for the face, neck, eyes, and body. Unlike older Thermage, the new Thermage CPT system allows patients to painlessly tighten loose skin in a single treatment session with no downtime. Tighten your neck and jowls or that tummy that was stretched by pregnancy with an immediate tightening effect that improves over the next 3 to 6 months. Call Plush Medical Spa today for your free consultation at 702-6869 or visit us online at plushmedspa.com. Hello, ladies.
Hey, Dr. Bell.
Everybody, I want you to meet Katie and Rachel. This is Rachel and this is Katie. If you can't tell them apart, you need to look at their shirts. It will tell you. There are beautiful estheticians here at Plush. And Rachel, why don't you tell us where you trained to become such an experienced esthetician?
Well, Katie and I actually have the exact same training. And we started out at Dothan Technology Center right here in Alabama, and right behind Northview High School. And we progressed. We went to Lurleen B. Wallace in Opp, Alabama, where they offer an amazing aesthetics program under the instruction of Miss Denise Stalls. And we interned at Ulta here in Dothan, too. And we're glad to say we finally ended up at Plush together, and it's a great place to be.
Well, you've kind of come full circle because you now have your own interns here at Plush. So
yeah, we finally do. And guess what? They're from Lurleen B. Wallace. So
well, you get to teach the younger girls how to treat their clients properly and how to do the chemical peels and all the facials the way they're supposed to be done. So what is your favorite thing to do here at Plush, Katie?
My favorite thing is microderms and chemical peels. That's definitely my forte. It's my favorite thing to do.
And I would guess that maybe Rachel's favorite thing to do is makeup.
absolutely.
She's our makeup artist, although both of them do the same jobs. Obviously, they have different areas that they like to concentrate on when they have the chance to choose. So we're going to talk about skincare today, and y'all are definitely the two people that handle that around here. Even for me, I let all of my clients have a consultation with Katie and Rachel so that we get their skincare regimen down in their charts and we know what they're using on their face. And that way we can always add in any sort of elements they want to add to their regimen, like vitamin C serum or things like that. And we're always able to help them choose products according to their own special needs. So we here at Plush carry the Obagi skincare medical systems, and you know, I'm a physician, so I've had the opportunity to try a lot of different things, and the active ingredients in Obagi are the ones that make the most difference for anti-aging and for general skincare. You know, cleansing's important. All of these systems have glycolic acid cleansers in them. Glycolic acid helps exfoliate the skin. As we age, the epidermis gets thicker and it gets more compact, so it's more difficult to remove. And so it's very important to not only have glycolic peels every once in a while, but to integrate a glycolic acid cleanser into your regimen to keep that exfoliation going. Taking away that extra epidermis that we build up over the years will increase the absorption of all your products, reduce pore size, and generally make everything look better. So it's always a good idea to start with the basics of a glycolic cleanser. So the nu-derm system here, Katie, you want to show it to everyone, is the main line, the original line from Obagi, and they've been around for a very long time. These are created by Dr. Obagi out in California, and I guess his skincare line's better known now than he is. Yeah. Certainly, the name says skincare, not the person anymore. So this line is the standard line. It works generally well for most people. It's actually a very good anti-aging line. It has the active ingredients to reduce hyperpigmentation, the dark spots that we get as we age. And that ingredient is called hydroquinone, and there's actually a couple of different products in this kit that contain that. All of the Obagi lines come with either a sunscreen with them or as purchased separately. It really depends on the line you're buying. But we suggest that everyone start with one of these starter kits because not all of the products run out at the same time. You can then replace them individually as you need to. So the other line that's more of a basic line from Obagi is the Condition and Enhance system. It's a little bit different from the nu-derm system, but not markedly so. We usually have people switch back and forth between the nu-derm and the Condition and Enhance depending on what their goals are at the given time. The Condition and Enhance line is one of the newer Obagi lines, but we can go over all the differences with you if you're interested in hearing all of that. One of the other really popular systems here is the CRX system. It's a choice for people who don't want to go through all of the steps of the nu-derm system. What do you think about CRX, Katie?
Well, obviously there are fewer steps, so it's a little easier for people to use, but it's not as harsh as the nu-derm. Some people really can't tolerate it. What I really love about it is the C serum that comes in it. You can use that with any line. It's wonderful. I love the C serum.
Well, and a lot of people aren't aware of what C does. The whole idea behind C is vitamin C. L-ascorbic acid is necessary for collagen cross-linking, and so it's a very important part of a complete anti-aging regimen. Any regimen that doesn't have vitamin C and retin-a in it is not going to be nearly as effective as one that does. So I really like this system a lot. It's perfect for busy people and for older women especially who want an anti-aging treatment, but they don't want to go through 8 different steps morning and night in different combinations. It's just a little bit less complicated. So I like it very much. And it's very easy to add these C serums into any regimen. Mm-hmm. So you don't have to feel like you're not getting the antioxidant effects of the vitamin C just because you're not using the CRX system. You can add any of our strengths of the professional C serum in to any of these systems. Generally, people start at a lower concentration and see how their skin tolerates it because vitamin C is an acid, so obviously there's going to be the potential for some irritation, but not nearly so much as maybe what people would see with retin-a or something like that. And speaking of retin-a is incredibly important. People with sun damage, and therefore most of us that live in the South, make as little as half the amount of collagen as people with normal, healthy, unphotodamaged skin. So anything that you can do to increase your collagen production is going to be a benefit to sun-damaged skin. Retin-a will almost double the amount of collagen that a person makes. Most studies have shown at least 80% increase in type 1 collagen production and elastin production as well. Elastin is hand in hand with collagen to provide youthfulness to skin. The elasticity is from where elastin gets its name. And Obagi, in addition to having some retinol and retin-a type products, also carries a line called Elastoderm, which focuses on elastin. So the Elastoderm products are for the areas that don't tolerate retinoids, retin-a as well. So the eye area is certainly key for the Elastoderm lines, and the décolleté area, which is always more sensitive than the face. What are the differences between the 2 Elastoderms we have, Rachel?
Well, one's a cream and one's in gel, and as in general, they're just about the exact same. But if you have an oilier excuse me, complexion, it is much better off using the gel. And you can actually put it around your entire orbital area. It's great for the crepiness and the fine lines, and same thing with the cream. And it barely takes a dab of this. It'll last quite a long time.
It does last a long time. I've had my original container for almost 10 months. And there's still quite a bit of it left in there. You use a very small amount. I use the cream. My skin tends to be on the dry side, but certainly people with acne and oily skin would be happier with the gel. I believe. The Elastoderm products, like I mentioned before, are also for the décolletage. They have a specific system just for that also includes a hydroquinone product that fades the dark spots. So we have 2 more systems to talk about, and they're more targeted toward the individual needs of not so much anti-aging, but specific problems that people encounter: acne and rosacea. Rosacea is a major problem in the United States. It mostly affects people of Northern European descent, and most people who have it don't know they have it. If you're a person who blushes or flushes, if you get red cheeks with alcohol consumption, if you go out in the wind and are particularly sensitive to windburn, you may very well have rosacea. Typically, rosacea is associated with those older men with the big red noses and rosy cheeks, Santa Claus-ish, if you will. But really, rosacea can affect men and women equally. I myself have a mild form of rosacea, and Katie also uses Obagé's skincare system for the rosacea patient. It's called RosaClear, and I'll let Katie tell you a little bit about it.
Well, this is the system that I use myself because I do experience facial redness. It has a gentle cleanser that's really, really great for sensitive skin. There's also the metronidazole gel, also called Metro Gel. That's the prescription ingredient in RosaClear. It's really great for anti-inflammatory, for the red veins people get around their nose area, and for any papules, pustules that can come with rosacea. My personal favorite product in this line is the Hydrating Complexion Corrector. It's really, really great for sensitivity, facial redness. It totally makes the redness go away. I really like that step.
I do too, and I guess I should probably mention that while my rosacea is mild, I did have my little red veins lasered at one point. Mm-hmm. They went away with the laser treatment, but they came right back. Mm-hmm. We don't really know the etiology of rosacea, so we don't really know why the treatments that we have work the way they do, but we do know that the anti-inflammatories are important in protecting the capillaries from dilation and leakage, causing that redness in the face. So both of those items work really well, although the only prescription item in there is the Metro Gel. I love this. I love this stuff, absolutely. I also add in a C serum and retin-a to my regimen. It's just with rosacea, you need to be very careful about your cheeks and your sensitive areas, so I pretty much avoid my cheeks and the area around my eyes and mouth when I'm using the retinoids, and I usually use those in the winter mostly. So one of our biggest sellers here is the Cleansiderm system. We have 2 different Cleansiderm systems, and they're for acne. One is the normal to oily system, which Rachel is showing you here, and the other one is the normal to dry. The dry system is not only for people with drier skin, obviously, but it's for those that are a little bit more sensitive, and it does contain a moisturizer. You yourself use this one, right?
I love this system.
What are your thoughts on Cleansiderm?
Well, I've tried everything from Ronan & Fields to Clearasil, Neutrogena to Skin ID, and this is the only system that's ever made a difference in my skin. I've had acne since I was 16, and I still fight it today, but you would never guess by looking at me. The third ingredient, or the third product with the most important ingredient to me is the best. It's the benzoyl peroxide, but it goes in the order of salicylic acid foaming cleanser, then a salicylic toner, and then the serum, and that's the biggest difference, is that the benzoyl peroxide is 5%, which makes it prescription grade, and because it's a serum, it actually gets to all your P. acne bacteria, reaches your problem areas, and does not sit on top of your healthy skin, so your skin gets the full effect of what it needs to. And you can actually add a moisturizer to it. If it's a little too dry, the third product, therapeutic moisturizer from the normal dry kit, you can throw that in there too. It won't hurt you.
Right. This kit contains both a salicylic and a benzoyl peroxide, and like you mentioned, the benzoyl peroxide is a very high strength. It's also made in a way that penetrates the deepest part of the pores, where the P. acne bacteria live and multiply. So if your product isn't penetrating as far as it could be, then there's probably a lot of bacteria still living in the base of those pores. No, I love this system. My husband uses this system. He's been on Accutane twice in his life. But the Cleansiderm has made a huge difference in his skin. It's actually improved his texture. He doesn't have as much scarring evidence as he used to have. It's definitely been smoothed out and blunted, probably from the glycolic cleanser in it. And, you know, he's also using this normal to oily, but he does add in the therapeutic moisturizer as well. And he hasn't found any, you know, he has had no bad repercussions from it, no acne as a result of adding in the moisturizer. Do you use the moisturizer as well?
I do, and I actually even use retin-a occasionally with hydroquinone about 2 or 3 nights a week. I can still add that to the system without it affecting my skin in a negative way.
Well, retin-a was originally made and FDA approved for acne. It was only through treating people with acne that they discovered how great it was for collagen production. So if we preach about retin-a over and over again and you're getting bored with it, don't. It's serious. Take us seriously. Retin-a is great stuff.